The Ghana Tourism Authority has directed all operators in the tourism and hospitality industry across the country to immediately start screening all guests before giving them access to their facilities. This is one of several measures put in place by the authority to ensure the industry is well protected against the deadly coronavirus. At a meeting with industry players Thursday, Chief Executive Officer Kwesi Agyeman said although the sector is reeling from the outbreak, there is the need to ensure operators can go about their business without fear and panic. It comes less than 24 hours after President Akufo-Addo announced a $100 million package to keep the disease at bay. Efwa Evans-Chinwe reports.
The World Health Organization has declared the coronavirus outbreak a pandemic as Italy tightened its quarantine and the U.S. imposed a ban on flights from Europe. More than 126,000 have been infected globally, according to the WHO. Of this number, over 68,000 have recovered. A number of institutions have put in place precautionary measures against the disease. One of such institutions is the Ghana Tourism Authority. Its Chief Executive Officer, Kwesi Agyeman, wants all companies in the tourism and hospitality industry to ensure everyone is very well protected.
We are telling our operators not to be scared, but just to take care. So the tagline is, don't be scared, just take care. And we are asking that at every public area in a establishment, there has to be an open display of the messages. And these are messages that we have printed and they have to paste out there. One, avoiding handshakes, the various precautionary measures that the Ghana Health Service has advised. Two, we are asking all hotels to ensure that in the hotel rooms, these messages are boldly displayed and there are sanitizers and other washing equipment that is available for people to wash their hands and avoid the handshakes. Also, in the area of the restaurants and the kitchen, they have to wear the protective gear. That will ensure that at least if even somebody has a symptom that is closer to coronavirus, they are properly monitored. And so we've asked that we get the testing guns, that we call them, to test their temperatures, and people with high temperatures are then isolated and then asked to liaise with the Ghana Health Service on that. We're also looking at general staff health. We know that per the regulations that we have, staff have to have a certain health certification by the various assemblies, and this time we are going to enforce that because they are the frontline people and they have to ensure. And by and large, we also here to keep the industry upbeat, that we are very, very confident in the measures that central government have put in place. We are very confident that thus far we haven't had any incident, and we are very assured of the readiness of the country to deal with the situation as we go forward.
Adnan Yusil is general manager at the Movenpick Ambassador Hotel. He mentions some of the challenges they face as an industry.
So since the pandemic disease started to spread all around Europe, we start to receive a lot of cancellations, especially from global institutions, international companies. Actually, we're supposed to have IMF World Bank meetings, some UNDP meetings, and some United States related meetings as well. They're all suddenly canceled. So we received thousands of room nights cancellations for March, April, and May, which accumulated to actually hundreds of thousands US dollars, which affected us dramatically. So now we are trying to take some precautions. Of course, we are an international company as a Movenpick. We are part of Accor. So we submit a lot of reports on how to reduce costs, how to hold on to our revenue. So now actually we try to minimize our costs.
Inspectors have been deployed to the various industries to ensure operators adhere to rules and regulations.
Well, the news team visited some of the facilities to find out what was in place.
We have placed hand sanitizers at the front of the hotel. That's the entrance when you are coming in. The restaurants, we have one also at the reception area, and we have some at the gym. So we are actually
There are sanitizers, hand sanitizers all over, in the rooms, everywhere.
Yes.
So let's talk about this. Where are you going to stick these ones?
So this one, we are going to stick some at the security checkpoint for the staff when they are clocking in, so that they can be reading and be aware of what to do when they are on duty. And also we'll place some also over there. Whilst guests are coming in, they can also be reading what they have to do to prevent coronavirus.
You know, we all don't speak English. What about those who speak other languages? How are they going to get to know about this?
We have people at the security checkpoint, and they can educate them. That is, if they get there and they read and they are not able to understand. But then if you look at the signage, you could see that, you know, this is something so easy that everybody could read. There is cross, that is don't do, and this is okay, meaning that you can wash your hands and all that. So the green one...
Without necessarily reading, you can tell. We're at the gym at the Alisa Hotel, and Yvonne is here to tell us what you have to do before you can enter the gym. So before you get into the gym, you have to sanitize.
Sanitizer to sanitize your hands. And then after that, you open the door. This has been cleaned already with the alcohol.
Okay.
Today going, we will put the stickers there so that you clean as you go with the sanitizers. Okay. Internally also, when you finish cleaning it, because of the safety of our customers, we will also do the alcohol cleaning to make sure that the treadmill is safe for them to use. Yes.
Okay. So apart from the treadmills, you're going to do the same with the other machines as well?
We are using alcohol to clean all the machines at the gym. So as and when they finish using it, we come back and then do the cleaning for this ones. Because this one, you don't normally sweat like the treadmill. So we do this ones for them.
I think it's a good idea on the part of the GTA, and we've also spoken about the coronavirus and its effect on the hotel business. I think we have also taken up some measures for the hotel and the guests incoming and in-house as well. Currently, we've taken up a measure that all staff will be given gloves and nose masks. Like you see, I have my glove here. There are two, yeah, and each staff has also been given, sanitizers as well. So we're taking up that measure, but we hope Ghanaians don't witness anything like coronavirus, because it's a pandemic which is currently affecting most countries.
Do you check visitors who come in?
Not really. Currently, we don't screen them, but we have a facility which is Impact Clinic. So if we notice any of their symptoms, we quickly take them there, and it's been catered for.
My colleague Maxwell Agwagwa joined public transport to observe how people are adhering to the education on the virus that has gone out so far.
I'm currently in a vehicle from the Circle Terminal heading to Russia, a place in Dansuman called Russia. And now here in this structure, in this commercial vehicle, popularly known as structure, what I've observed is that there's nothing like personal space. There's no way you can avoid the next person, sitting to you. President Akufo-Addo yesterday in his address to the nation on COVID-19 advised us to, as much as possible, try and create, some space. We should try and reduce, personal, contacts. In fact, doctors have actually advised that one of the ways to stay away or to be safe from the coronavirus is to avoid crowded places and contacts with people. But here in the Trotro, there's nothing like personal space, I tell you. Even here, as I said here, I try as much as possible to avoid Elijah, but I cannot avoid him.
So the advice I'll give to them is, when you enter into a trust key, you should be careful. Careful in a way that someone who is coughing, someone might be sneezing, you might not know if the person is infected or not, because at that moment it doesn't show, the signs and symptoms doesn't show at that moment. So when you come into contact with someone who is coughing, sneezing, I think when you have an handkerchief or something, when you are direct to the person, the best way to do is when you have an hanky, you just pick it up. Someone coughing, someone sneezing, so that at least you cover your nose like this, so that when a person is coughing and it will not come into contact with you. And I think the best way to is most of them should carry hand sanitizers along when they are going to work or anything, so that once a while they just drop some and then just rub it on their hands.
Now, just sitting here, the mate just coughed right now, and I don't know whether I should run out of the car or not.
I mean, the car is a baby, I'm from Pybon, Babon, Maya, serious, and yes, I already want to move a concern, Baba too.
Well, what he's saying is that we need to take our prayers seriously. We need to pray against the outbreak of coronavirus here in Ghana, because we do not know how these infections, come about.
Some people, they are just stubborn. They don't follow the rules, because when you tell them to wash their hands or use sanitizer, they think, oh, after all, Ghana germs, African germs are friendly. Yeah. So some people, they just do but we just thank God that we are all safe, because some of the things that we do, in case that virus should strike right now, I think it will be very, very bad.
Now, Maxwell Agwagwa also spoke with the Vice Chairman of the Odona branch of the GPRTU, Alhaji Isa Mohammed, who says they are helpless and want government to assist them with sanitizers and education.
We didn't, this epidemic, we hear that the epidemic now is in Togo.
And other neighboring countries.
Other neighboring countries. But you see, we didn't hear about the media. The media is supposed to talk more, but we can do our effort here. Okay. But let's take it, God forbid, let's take it when somebody have the virus here. What will you do? What we will do with advice or with experience we have here? We can't do anything.
You can't do anything? We
can't do anything, we don't know. But we hear that they said we should find sanitizer. Some of people say we should find when you get soap and this thing. But
you seem helpless. But have you not thought about maybe putting bowls of water here so that for passengers who would board the vehicles that are parked here, they'll wash? You insist on proper hand washing before they get onto the vehicles. Is there not a suggestion you are considering or anything?
Oh, that one is good. Now you are advising us. You understand? That's why we are saying that the government or the municipal assembly that control here, or the MP or the assemblyman, supposed to come educate us more, because we are many people here. Now, what will you do? We don't know anything about it.
The University of Cape Coast has banned all international conferences on campus as part of measures to tackle any threat of coronavirus there. This follows a declaration of the outbreak as a pandemic by the World Health Organization. Here's a report by Richard Kujinyako.
The university is an international institution, so we have international partners visiting us every now and then. So one of the decisions we have taken is that we are suspending all international conferences that we are supposed to host until further notice. And until further notice means until the Ministry of Health advises us that it is safe for us to host travelers who are coming from elsewhere. So we are suspending all international conferences. We are also suspending all international travels for our own staff. There are staff who are supposed to attend conferences elsewhere, seminars, workshops. For some of them, we have even issued tickets. We have booked accommodation, but we have to suspend them.
Now, temperature monitors will soon be installed in Parliament to screen MPs and visitors for COVID-19 symptoms. Speaker Professor Michael Quay, who announced a number of measures on Thursday morning aimed at protecting the staff, charged the clerk to provide the monitors after it was suggested by Minority Chief Whip Muntaka Mubarak. He urged MPs to avoid shaking hands and take seriously the measures put in place.
I suggest, if it is possible, your office could take these additional measures. The temperature recorder, because of the number of visitors that we receive in this house, if it could be possible for it to be used at the vantage entry to check the temperature of people who are visiting us. Mr. Speaker, I believe that this could even be done to members too. I mean, if every morning we come, as we prepare to enter the chamber, our temperatures are checked, so that at least we'll avoid a situation where infection could be spreading within the chamber premise system.
So we're back, just about taking a break here on Joy News Prime, but here on Joy News Prime we decided that we should continue the education. So each time we have a story on COVID-19, we're going to tell you what you're supposed to do, the do's and don'ts. So we're taking this from the WHO. It says, is wearing rubber gloves while out in public effective in preventing the new coronavirus infection? And this came up when we're interacting with one of the hotel staff, a member of the hotel staff. It says, no. Regularly washing your bare hands offers more protection against catching COVID-19 than wearing rubber gloves. You can still pick up the contamination on rubber gloves. If you then touch your face, the contamination goes from your glove to your face and can infect you. Now, how should I greet another person to avoid catching the new coronavirus? This one, the president has taught us many times. It's about you using your elbow or any other means apart from using handshaking. It says to prevent COVID-19, it is safest to avoid physical contact when greeting. Safe greeting includes a wave, a nod, or a bow. And then, should I avoid shaking hands because of the new coronavirus? Yes. Respiratory viruses can be passed by shaking hands and touching your eyes, nose, and mouth. Greet people with a wave, a nod, or a bow instead. And that's how we do it. We're taking a break. Still ahead, though, doctors at the Kolebu Teaching Hospital are worried at the alarming number of young people presenting with kidney ailment. And Education Minister describes as unmatched in the 63 years since Ghana became independent the interventions made by the Kufuor-Addo-led administration in the area of education.
It's to do with the curriculum. The teacher curriculum and the pupil curriculum are now world class.